I'm Nick Williams and you're watching Medicare Pro TV. And in this video, I'm going to talk about the cost of Medicare when you're turning age 65 and you're new to Medicare. So I'm going to go through this. I do want you to know that while you can listen to our videos, and we have lots of them, and we're always adding more to the library, that you don't need to figure all this out. You can call us or go to MedicareProTV and just click get a quote, and we'll get with you and we will help you out. So save yourself the aggravation. I'm going to Medicare.gov and I'm going to start with the cost of Part B. We're at Medicare.gov, as you see on the screen here, and I'm going to scroll down and you can see if your income is $85,000 or less, your premium for Part B will be $135.50. In all likelihood, in most cases, your Part A is not going to have a premium because you paid for that over the years. There's exceptions to all rules. But again, for 95% of Americans, it's going to be $135.50. This is going to be deducted from your Social Security check. If your income is above that, you can see the schedule here. Your monthly premium, the amount of money that's deducted from your Social Security check, increases. And you can see the schedules right here. You can go to Medicare.gov and reference these same items. But I'm going to move on. So again, we're at a baseline for 95% of Americans or Medicare beneficiaries. Their Medicare Part B premium is $135.50. Now, you also will need to purchase a drug card. Most everybody should purchase a drug card. If you get a Medicare Advantage plan, it may be rolled into that program. But in most cases, you're going to purchase a drug card and you're going to go again to Medicare.gov. Now, this is the home page of Medicare.gov. And you can see if you go type in Medicare.gov, right here, you see Find Health and Drug Plans. I'm going to walk through this with you so that you see how simple this is to navigate. So you just click on that button there, put in your zip code. I'll put in my zip code here. And I'm going to click that I have original Medicare. You will have original Medicare and you do not get extra help. And then I want to continue. Oh, would you like to add drugs? We're referencing a drug card here. So the answer is yes. I would like to add drugs. Continue to plans. And what this does is it enables you to enter the medications that you're currently taking. So let's see, I'll put in metformin. Let's see, that's a common medication, and I'm going to say my drug list is complete. Now look what it does here. It allows you to go to actually enter the pharmacy that you will use. Now I'll just type in CVS. And what will happen is I'll go to the bottom here and it'll go to plan results. And then I can go and select drug options. So I'm not going to go into that now, but I just want you to understand the cost of the drug card. What we have or will have other videos that detail how drug cards work and drill down on that. What you need to know, again, and what we're focused on here in this video is all this is going to cost you. So we're at $135.50 for the Part B. And the average, as you see on your screen here, let me see if I can blow this up a little bit more. The 2019 base premium is $33.19. You're not going to pay $33.19. You're going to pay more or less than that. In South Carolina, where I am, there are plans that are under $20. Then you have to factor in the deductible and other issues or other coverage elements of the drug card to determine what's going to be best for you. But we're going to work with the average cost, which is $33.19. I'm going to elaborate on that a little bit. If you take no medications, you do not have to purchase a drug card. I would suggest you do, because you do accrue a penalty for not doing so. And it may be better to have it and not need it than the other way around. So here we are at the next, your next step. And in no order, but this is what you will also have to do, is purchase a Medicare supplement. Otherwise, you leave yourself exposed for heavy out-of-pocket cost. Medicare as a base plan is good, but you need a supplement. And most people will get a Plan G. Plan F is the Cadillac, if you will, but that's going away in 2020 for new Medicare beneficiaries, people that are aging in after a certain date in 2020. I do not suggest that you sign up for a Plan F for various reasons, which we won't get into in this video, but instead a Plan G. In all likelihood, there are states that you will not, that it may be more advantageous, and there are reasons to sign up for other plans, but in most cases, it's a Plan G. And your premium is, okay, here in South Carolina, it's about $100 on average, depending on male, female. In other states, it might be $150. So I'm going to use, and there is no, I don't have an exact average here, but I'm going to just use a number that's a very fair number, is $125. So we have the $135, and let's go sum these numbers up here. We have the $125 for the Plan G, which I'm approximating. We have the Part B cost of $135 and the national average cost of a drug card, which is $33. So that's a total cost of $293. You might be $25 more or less than that, depending, and even more so, it could be more extreme than that, depending on which state you're in, because these plans are state specific, and also whether you're male or female. Your outlay, your total outlay out of pocket, because keep in mind, this $135 here, that's coming out of your Social Security check. So the number you're going to have to get used to, the check you're going to have to get used to writing is $158 if you combine these costs. And again, that's a good deal. Depending on where you're coming from, corporate benefits, or maybe you're coming from Obamacare, maybe you have no insurance. In all likelihood, this is going to be an improvement over where you were prior to arriving at Medicare, because you do not have a deductible. If you do this the way I suggest, you will not have a deductible. You'll have for no hospital deductible in comparison to thousands and thousands of dollars with many other plans. Even corporate plans are deteriorating in their benefits. Medicare is a wonderful plan, and you're looking at $158 that you're going to have to budget. No deductible for the hospital. Right now, it's $185 deductible for outpatient. So you pay again, that's with that Plan G that I suggested. And your drug card, that's going to be a variable, and it depends on each state is different, each company is different. It really is a gray area. You got to go to that healthcare.gov. You got to type in your prescriptions. That's your best bet to get the most accurate information, and we'll help you out with that as need be. So that's it. I think you can see it's fairly reasonable, and we appreciate you tuning in to Medicare Pro TV. We want you to go to our website. There's a button there where you can get a quote that will enable us to get with you, and that will be probably your best bet. You don't need to know all this. You don't need to know all the details, but we will give you as much information as you desire in order to make an informed decision. And we'll talk to you later.